Welcome to the Babblesnonsense podcast, where I'm your host, Jonna Grimes, and we're here to discuss any and all things, but especially the shit that I want to talk about. Because let's face it, I have a lot of shit to say, and after all, you are listening to my verbal diary. Let's get started. Welcome back to another episode of the Babblesnonsense podcast. I have Dr. Degraaff from Advanced Life Clinic sitting here with me. It has been difficult to get her because she is so busy with all the stuff that she is doing and in her beautiful new place. But she currently works here in Huntsville, Alabama, but everyone around the world likes to know about aesthetics, fillers, and Botox and things such as that. So we are going to dive right on in. So welcome, Dr. Degraaff.
Thank you. Thank you for having me, Jonna.
Of course. I wouldn't want to have anyone else to talk to filler and Botox about.
I appreciate that.
So everyone wants to know, how long have you been doing aesthetics altogether?
So we opened our doors in a very small, tiny 1,200 square foot building in November. Well, it was actually November 15th of 2004.
Oh, wow.
So we're in our 16th year.
That's exciting.
Yes.
And then you just moved into your new building.
Correct. After that, we moved to a different building with about 3,000 square feet, and now we just purchased a building which is about 2 blocks from where we were on Queensberry. I call it the old Steinmart Shopping Center on Airport. On the Surin restaurant end, there's a little side street, and we're just across the street from that.
And now this is your biggest building, right?
Correct.
Because you've grown so
February
much.
1st. Pardon?
I said you've grown so much.
Yes.
So
and we're already we have an empty lot next to the building, and we're already figuring out
oh, wow,
how we're going to expand and add on to the building. But
that's exciting.
I know, right?
So you started out with aesthetics, just aesthetics in general, or how did you start your practice?
My background is primary care.
Okay.
But I haven't done primary care in the 16 years that I've been doing aesthetics. Originally, because of my primary care background, was more interested in the medicine of anti-aging, hormones, and diet, nutrition, wellness, things that you're interested in as well. But 16 years ago, nobody had a clue what I was talking about. Mm-hmm. Now it's obviously very mainstream, but 16 years ago, it seemed a little out there. So things that seemed to be more mainstream in Huntsville, Alabama at the time were fillers and Botox. Everybody knew what you were talking about when you discussed that.
Yeah.
So that's and laser hair and lasers. Laser hair removal is a huge part of my business when we first opened. So we started with that, kind of got our footwork going and built some momentum, and then we gradually added in medically supervised weight loss and hormones and more of the medical side of anti-aging and wellness and aesthetics as time went on.
So would you say that's your favorite thing that you've done so far? Do you like doing the filler side and kind of coming away from the others?
At this point in my career, my favorite thing to do would be filler, what we call liquid facelifts, or that's really what we call them.
So do you think that your liquid facelift, because I think so, because I know we've talked about the diamond facial, the Instagram face. I think that your liquid facelift is the same as the Instagram face.
Everybody kind of has their own terminology that they use, but we're basically talking about the same thing. There's only so many places that you are going to inject in someone's face.
Yeah.
But the end point is the same. Everybody has their own little catchphrases, the lip flip, the Nefertiti lift, the 8-point lift, whatever it is. We're roughly all doing the same thing.
So speaking of where you can only place it so many times, I had someone ask me, what's the difference between putting Botox in your face versus filler? Because I know I've had people say, you've got Botox in your lips, and I'm like, no, it's filler. A lot of people still don't understand.
There's no lifetime limit to either one. You can put as much as you can afford or as much as your injector's willing to put in. Hopefully someone would stop you before it gets to be ridiculous, but there's no toxic limit. People think Botox is a toxin and I can only have it so many times, but that's not true. Each batch, so to speak, that you put in goes away every 3 to 4 months to nothing, and then you start all over again. And if you need to quit, a lot of times younger patients in their 20s, and we'll talk about that in a minute, are coming in and they're like, oh my gosh, am I too young? Am I committing myself to doing this for the rest of my life? And the answer is no. If you move, if you decide to go back to school and your income level changes, or you have a baby, or you're breastfeeding, any of those changes in your life as you go through through the years, if you need to quit your Botox at any time, you'll just go back to the way you look. Same thing with filler. Gradually, it takes longer for filler to go away. But if you need to quit, want to quit for whatever reason, you can stop at any time, or you can do it forever. I mean, there's really there's no end point. There's no.
Well, that's what I was going to ask you. Because so you see all these people from LA that sometimes they just kind of go drastic with it. But if you just are getting it like, natural.
Hopefully your friends, your injector, someone's going to say, okay,
stop.
Enough. Yes, we've reached the point of diminishing return here. We're actually, going backwards. We're not we're looking unnatural at this point.
So like for me, filler, I think it's great for that, like enhancing what you naturally have, what you're really good at. You do that natural look.
Correct.
And so if you're doing the natural look over time, if you, like you said, something happens, income, or you can't do it anymore, you just go back to the way you were looking.
Correct.
Okay. So nothing's changing.
If anything, and one of the questions I think we've been asked that we're going to answer today is, you're actually better. Number one, Botox is preventative. And the analogy that I use is, if you never fold a piece of paper, you never get a crease in the piece of paper. Well, the skin is the same way. So for whatever length of time that you did Botox, let's say you did it for 5 years and then you get pregnant. Well, for those 5 years, you've prevented further wrinkling. And with filler, now Botox not so much, but with filler, the actual process of injecting the filler, it's thick and the needle's a little bit bigger. It actually stimulates collagen during the healing process. So you've actually been stimulating your own collagen by actually having filler put in. So both of them, through time, the longer you do them, the better off you are in the long run.
Well, that's very interesting. I know I started doing Botox, I think I was 26, and I had some really deep wrinkles in my forehead because I have a big forehead. You know that.
But a beautiful forehead. That's a sign of intelligence.
Actually. Oh, is it?
Yes, it is.
Well, that's cool. But I don't think I'm that intelligent. But that is cool. But yeah, they're gone now since you've been injecting Botox in my forehead.
And I do think the longer you do Botox, if you're not creasing the skin, then it actually corrects what we call static lines, which are lines that you already have that are there when you're not moving. I think some of your static lines, after a couple of years of doing Botox, actually go away.
That's very interesting. So I know filler goes in the lips. You can do it the lips, the cheeks. Where can you do
endless. People are putting it everywhere. I mean, literally. There's some really crazy stuff going on out there, and it depends on what kind of filler you're talking about. But I would say the most common for me are under the eyes, in the cheeks, in the chin, and the lips, and the nasolabial folds.
And then someone asked me which filler is best for different areas. If they're not so this podcast is kind of if they're not coming to you, if they're in other states.
So when I started 15, 16 years ago, we had 2 fillers, and they had to do everything, and they weren't optimal for everything. There's certain areas you don't want to put what we call a juicy filler, a filler that draws a lot of water to it. You wouldn't want to put that under your eyes because it's going to look puffy. Yeah. So the companies went back to the drawing board. They took that original either Juvederm or Restylane or whichever one it was, and they conceptually, this is not really what it is, but it just makes sense to people. They either thickened it or thinned it to make it more appropriate to suit certain areas of the face. So if you want to do a cheek lift, you're going to take that original Juvederm, and they've modified it to something called Juvederm Voluma. And that's the one you're going to use in the cheeks. If you want super fine lines, like what we call smoker's lines above someone's lips, there's a very fine, very superficial lines. Then you're going to want to take the version of Juvederm that they've thinned down called Volbella. Okay. And there's other ones on the market, but that's 2 examples of where would you use a thicker version of the original Juvederm, and where you use a thinner version of the original Juvederm.
Okay. And then also,
but I think the point is it's not just one size fits all anymore. And there's even more than that. There's biostimulatory fillers like Sculptra. So it really comes down to a very detailed consultation with your injector to figure out what filler is the best.
And definitely, obviously, go to someone that knows what they're doing.
Correct.
Because there's a lot of pop-up shops now.
Exactly. And just somebody who's was there in the day and kind of knows why we have different fillers. Because, we had to make one filler fit everything, and it was difficult. So I think someone with a good history and somebody who's injected quite a bit, and I am a master diamond level injector with Allergan. So if you really it's simple things. I mean, a newer injector would be fine doing just a basic set of lips, but when you get into more involved areas, tear trough correction, cheeks, chins, things like that, you really do need to have somebody who's pretty experienced and knows what they're doing.
And since you spoke of your master injecting, that was going to be one of my questions. How do you become a master injector?
It really is a certification and a long process of how many you've injected, how many years you've been doing it. Can you do master techniques that are a little bit more difficult, a little bit more challenging, and unfortunately have a little bit more risk. Injecting fillers is not a risk-free endeavor.
Yeah.
However, there are ways to make it much more safe, less painful, less bruising, and a master injector is definitely going to be more familiar with those techniques.
Which is awesome. So as far as bruising, I know a lot of people ask this, and I try to explain to them, like, I bruise all the time. I'm just a bruiser. I could bump up against a chair and bruise. So when they get bruises, they're like, oh my gosh, and they freak out and they get upset. But I think that comes with the process. Like,
it does. Bruising is always one of the very first things that I go over with a new patient, pain and bruising. I mean, that's what new patients want to know. Is it going to hurt, and am I going to bruise?
Yeah.
And yes, there's always a possibility when you stick a needle in someone's face that they're going to bruise. The good news is aesthetic with non-invasive cosmetic procedures, the bruises they're typically small.
Yeah.
They're about the size of the end of your finger, a pencil eraser size. They're easy to cover up with makeup, and they really shouldn't cause you to cancel plans or take off a day from work. Now, you can if you're a newbie and you've never been injected and you just don't know, or you know that you're an easy bruiser, you might plan to do it on a Friday or have the day off the next day. But typically people insert cosmetic injections in their daily life.
Yeah.
They either do it on their lunch hour or they do it before work, after work, and then they don't really cancel or delay any of their plans.
Well, COVID
really
has helped
not
me.
Necessary.
COVID has helped me with the masks.
Pardon?
I said COVID has helped me with the masks.
And I have to admit, that has been a topic of conversation many times this last year is, if I get a bruise, I can cover it up with my mask.
If my lips swell, I can just put a mask on and go straight to work.
I can think of only a few good things about the mask, and that would probably
That's probably my top one. Is like, I can go get my lips done.
Yeah.
So let's just, since we're on the topic of my lips.
Yes.
Okay. So I started getting my lips done, same time Botox, 26, 27 years old. Got it done the first time in Nashville, and then moved back to Huntsville and came to you because I was recommended by a bunch of my friends that go to you.
Okay.
In Nashville, it didn't seem to be much of a big deal. No one seemed to care that I got my lips done. But as soon as I moved back, it was almost like you're too young. What are you doing? Do you feel like it's a stigma in the South that it's that way?
I think smaller towns, Huntsville is very up and coming right now.
Yeah, I was going to say it's evolving, definitely.
And I will tell you, 10 years, 15 years ago, to have a 22, 24, 26-year-old doing these aesthetic procedures, Botox and filler, was not as common.
Yeah.
But I will say, as of today, 50% and maybe even more of my new patients are in their 20s. So I think the stigma is much less, and a lot of that obviously is driven by social media, especially on Instagram. But younger and younger influencers, the Kardashians, people like that, are having things done younger and younger. So I think the stigma is going away.
Which is awesome.
I think if you have the confidence and the budget, and you have no needle phobes, unfortunately younger patients are more afraid of pain and the needles, but all of those things, you can handle it financially, the pain and everything. I say go for it. To be honest, the products are actually FDA approved down to age 18.
Oh, really?
I really don't see that young yet, but I'm seeing definitely a younger crowd, early 20s, mid 20s, starting the lips, starting a little bit of Botox.
I was about to ask you.
The message is coming through on social media.
Yeah, like what would you say your average age range of your patient is currently?
Well, if you can take everybody in the clinic, it's going to be older than that.
Okay.
30s, 40s, 50s even. Because I have, some seasoned ladies that have been doing this for a long time. They're adding to surgical facelifts, which we could talk about.
Yeah.
Where do aesthetics fit in for an older patient that's actually had a surgical facelift? And they still need it. A facelift is not going to make your lips smoother. It's not going to fill in under your eyes. So, but back to the younger patients, the average age for my patients is a little older, but the new patients seem to be getting younger and younger.
Yeah.
Or maybe I'm just getting older.
No, you are not. No, you're not. No, I mean, I know from watching the Real Housewives and stuff, and Amelia Grace and them that are Lisa, not Vanderpump, but Lisa Rinna's children. they're like 18 years old getting lip filler.
Yes.
So, I mean, it's starting to go farther and
Correct.
farther down.
And I think a lot of that is also, you know, what God gave you.
Yeah.
If you have a very thin lip naturally, then you're going to do that younger. Lip thinning is also, so let's pretend you have very beautiful, full lips, and you don't need it in your 20s. Your lips do thin as a product of age.
And then,
so they're either coming to me young because they just were born with smaller lips, or they are, you know, having them replenished because they're losing their lips as they age.
So now let's get into what is the difference, because I did not know this until a couple years, the lip flip versus lip filler. I know that's a big question.
A lip flip was a term that I didn't know until about 2 years ago.
Yeah,
but
it's
an injection that I've been doing for years and years. It's another one of those Instagram phenomenon or YouTube phenomenon where some injector somewhere started calling something that we've been doing for a long time a certain name. So the lip flip are actually upper lip injections, which we've done on older patients for smokers' lines for years. If you don't purse or pucker that upper lip, and that muscle can't contract, it smooths out smokers' lines. In younger patients, they don't have the smokers' lines, but inadvertently, when that muscle relaxes, it literally flips the top lip out slightly. It's not as much as if you're going to have a lip injection with filler, but it's a way that younger patients can kind of tip their toe into this area and see what having a little bit more volume. It gives the illusion that your upper lip has more volume without actually doing filler and making more volume. So it's a kinder, gentler, and it's also a lot less expensive. A lot of 20-year-olds don't have the budget sometimes that older patients have because they're in school, they're just starting their career. So for $80 to $120, they can do a little lip flip, got to get a little illusion of some volume, and it goes from there.
Well, that
and then filler obviously is filler.
Yeah.
I mean, and there's different things we can talk about that. The new thing on Instagram is the Russian lips.
Yeah.
Which once again is a technique for injecting lips. It's been around for a very long time, but somebody actually started calling it that, and it becomes a hashtag, and then it takes off on Instagram. But it's a slightly different way of injecting lips, which actually increases the lip height, and not widening the lips. So and that's going to be decided whether you want a more traditional injection technique or the Russian technique in a consultation with your injector.
And so when people come to you, like if they say, you know, I want this Kylie Jenner lip, and you know it's not going to look good on them, you're going to tell them.
Correct.
And that's what I know you do with me, because you're like, no, Jonna, you need to quit.
Right. And it's a lot of times. So I did a consultation today. A young lady, she's a makeup artist. She has a very small mouth, and I recommended the first thing we do is a more traditional technique and try to widen her smile out a little bit. And then the next time we do it, and that's another thing, I really recommend you only put one syringe in at a time.
Yeah.
The lips need time to expand, the pain, the bruising. It's just more prudent. It does better if you don't try to put too much in at one time. And then, so back to the patient. I told her, you know, in a month or when we're ready to do a second syringe, we'll go to the more Russian and try to actually increase the amount of lip that's actually showing to the outside world. So we're, you know, sometimes people need both techniques. Sometimes people, they already have a pretty wide, beautiful, broad smile, and we just want to increase the height of the lips. So that patient, I would recommend a Russian lip. Some people want more forward projection. Their lips are kind of flat in the front. And that patient, you'd want to do more of a traditional lip injection technique.
So this is true artistry. Like you
really
just have to kind of like puzzle
it's very specific. It's very individualized. It's very depending on the patient, what they want, their anatomy, their profile, the front, the way they look in the front, the way they look when they smile. You really can't evaluate somebody until you see them moving. I actually, when I bring somebody in and I'm doing the consult and they're talking to me, I'm really looking at their lips. Well, they don't know it, but I'm studying how their mouth moves, how they hold their lips. When they smile, I'm seeing how much gum is showing, literally when the lip rolls up in the front, how much of their teeth is showing. And all those things go into making a determination on what you recommend for each patient.
And do some people come in, like if they have asymmetry, and they don't really want,
definitely.
If they don't really want like a fuller lip, but they want their asymmetry fixed, can that be done with filler?
Correct. Most of the time I do get more requests to have more put in the upper lip, because typically the upper lip does tend to be smaller. Occasionally you'll get that perfect 50 to 50 ratio between upper and lower lip. But most of the time people have maybe 20% smaller upper or vice versa. But typically it's the upper, and you are going to divide your filler. You're going to put a little bit more of that 1 cc syringe in the upper than you do in the lower. Or sometimes an arch on the upper lip. Think about how it arches up. One side is a little higher than the other, and you can also work on that as well. And I have pictures of that on my Facebook of people that I've fixed the ratio of top to bottom, and then I've also fixed the the symmetry, the asymmetry that they might have on the top.
Now, also, if someone comes in, they're like, I just want lips, but you can, like, do you look at them and say, well, actually, I can fix your lips if that's all you want, but you really need, like, whether it be your...
I kind of give them a heads up. I don't want to overwhelm them. If they come in for just their lips, then we'll talk about the lips. But I'll also say, we're going to get these lips looking really nice, but at some point you're probably going to want to address this or that, or it's going to look better.
Yeah, that's what I was going to say.
Lips, if we fix your marionette lines, or your nasolabial folds, or we bring your chin forward. A lot of times there's a profile problem. It's not just looking straight on at someone, but what do they look like from the side, and do we need to do a little chin augmentation so these lips don't stick out too far? So it really, but I try not to overwhelm them in the first visit and just kind of lead them into the next phase.
And speaking of that, someone did ask me, and I told her she did not need this today, and I'll tell you who it is after this, but she wants to know, she has under chin fat, I guess. She was like, what would you do to get rid of under chin fat? Would it be like something like filler, Cabela?
And so that is called the submental fat pad.
Yes.
And everybody has one, even thin, skinny people. Yeah, it's genetic. And there's 2 different ways to get rid of it non-invasively. Non-invasive, we have Cabela, which is an injection.
Okay.
And that is it's a product made by Allergan, who makes Botox. So a very famous, big, huge company makes this. Cabela is injected underneath the chin. And what it is, it's an acid that's actually found in your gut that breaks down dietary fat.
I didn't know that.
So they figured out a way to make it, and we just take it and re-inject it into fat in your body, and it dissolves it, basically.
Can it only go under the chin?
They're studying it. There are people that are using it sort of in the, like if you suck like a fish lip, if you want your cheeks to be more sunken in on the side. There's people that are using it there. There's people that are using it in, quote, bra fat.
Okay.
Right? That little pinch of fat that's above your bra line. So they're off-label. It's not actually FDA approved by Allergan yet, but it's coming.
Wow.
And yes, people are sticking it in different places.
That would just make me nervous because, like, if you get rid of your fat in your cheeks, like, what do you do when you're older?
Yeah, that's a little more advanced technique. I don't even do that one. I have to admit, I'm not as skilled. I don't do as much Cabela as I do other fillers, but there are some injectors out there that are injecting Cabela to sculpt in underneath the cheekbone to give a more sculpted look.
That wouldn't make me
nervous. Your other option for underneath the chin, just back to that, is cool sculpting. Cool sculpting actually freezes the fat. That's a machine. It's not an injection. And a device is placed underneath the chin. It sucks the fat into the handpiece and literally freezes the fat, but not frozen enough that it causes frostbite to the actual skin.
Yeah.
But it freezes the fat, but not the skin. Frozen tissue dies, and then it liquefies and goes away over several weeks, 6 to 8, 12 weeks.
That's crazy.
and the versus Cabela, which is also liquefying the fat. And it goes away gradually. So neither one of them are immediate. It's not like having liposuction, but they do both work beautifully. But it takes 3, 4, 5 months to see the final results.
Okay, and then I know we've talked a lot about filler and Botox, but as a clinic overall, like, what kind of stuff? I know you offer a lot of things, but to kind of give people here in Huntsville, if they wanted other things other than just filler and Botox, what could they come to your clinic for?
We started, one of our main procedures was lasers, and one of the most popular lasers out there is laser hair removal, and we still do a ton of laser hair removal. Tattoos are removed with a laser, so we have a separate laser that does that. We have a laser called an IPL, and that stands for intense pulsed light. And that's just a kind of a laser that removes, think of brown spots and freckles and sun damage and acne that turns into a brown spot. All of that can be removed with an IPL laser. Cool sculpting, which I already talked about with the under the chin fat, but its main claim to fame is sculpting the body. Love handles, the front, roll in the front. We have a machine called Tempture Envy, which is a ultrasound based to do skin tightening and collagen remodeling. I just hired a dermatology nurse practitioner, and she does more medical dermatology. Think, I have a mole, I need it biopsied, I have a rash, treating acne, things like that. So, and we brought her on so that we could bill insurance. So 90% of 75% of what we do in the office, you can't bill insurance. Botox, well, if you have migraines, but typically no.
Don't we wish?
Cryer is her name, and she is there to see medical dermatology, psoriasis and eczema, and those kinds of things. And we bill insurance for that. We also do primary care. My original background, although I haven't done it in many years, is primary care. So I have another nurse practitioner, Hayley Degraaff, which you've already done on your podcast. She does my primary care and my bioidentical hormones. And we do all manner of bioidentical hormones. We do the creams, we do pills, we do pellets.
Yeah.
So, and I actually have to put those in. Carrie can't put those in yet, but we're working towards that. And then... I have a registered dietitian nutritionist, Katie. She just passed her boards this past spring, so we're very happy for her. And she is, last spring actually, she is on board to help us with our medically supervised weight loss programs.
Now, y'all do it all. Like, it's a one-stop shop.
We're working on
now
it.
You just need a massage therapist.
Yes.
A lash extension artist, and
we just hired a new esthetician. So we now have two Carries. We have old Carrie, new Carrie. New Carrie she is actually a licensed esthetician, and
cool.
she's going to be leaning more towards chemical peels and facials, skincare.
Which y'all, speaking of skincare, y'all are the SkinCeutical flagship. Is that correct?
We're the first and only SkinCeuticals flagship store in North Alabama. So we have the expanded skincare line. We pretty much carry every SKU that they have, and we're the only one up here, because we're the only flagship. We have the custom dose. That's where you can actually come in and meet with one of our skincare specialists, and we can make a custom. Literally, it's a machine.
I saw it. It's so cool.
And it puts little aliquots of different ingredients in one little bottle, and then it spins it and mixes it all together, and then it's literally a custom dosed skincare product made specifically for you,
which is awesome. And then you have what's that thing you stick your face in that I stuck my face in?
It's just called a skin analyzer. Okay. And you stick your face in there, and it tells you where you have clogged pores, where your blackheads are.
Oh, mine was awful.
Mainly its claim to fame is sun damage.
I looked like one big freckle. We got a lot of work to do.
My 17-year-old put her face in there, and it was flawless.
Which is amazing.
I know. I was like, this is the perfect skin, so I took a picture. And then... my 21-year-old, hers was almost, but just that difference in 4 years, she's already starting to show a little bit more sun and clogged pores than just at 17.
I wish
talk about.
My mom would not have let me lay out in the sun like I did.
I think the next generation in their defense are doing a lot better.
They are. Like spray tans are in.
Tanning, they didn't exist.
No.
We either went and laid out with baby oil on the roof of our friend's house, or we were white as ghost. And, trends
Pale
change.
is not in.
Whether tan is in or tan is out. But, we had the kind of selfless tanner that turns you literally like an Oompa Loompa orange.
Yeah, it's gotten so much better.
Much better.
Thank the Lord, because my pale skin just cannot.
You are redhead and blue-eyed. You're not going to be a beautiful tan, I guess.
So future goals for your clinic. I know you said you already are looking at purchasing another area.
Correct. We're going to continue to expand our offerings, we hope, in lasers as new things come out. I'm looking at offering threads. Threads are big.
Yeah.
So
explain.
Most injectors who reach a master injector level. My history with threads, I've looked at it off and on for longer than a lot of people have been even out there. So, and threads have come and gone. The popularity, the effectiveness have come and gone. I do think that the line of threads, these PDO threads that we have right now, are good enough to delve into. In fact, we're doing a training with them, and so I am definitely bringing it on the threads, the PDO threads.
That's cool.
Those will be coming hopefully in another month or two.
Because I know, like you said earlier, it just depends on trends. Because I know I listened to someone in LA on someone's podcast that they think that these threads are new, but they're not.
They're improved.
Yes.
Let's put it that way. And I do think the ones that we have, the technology's improved. There's been a lot of R&D, research and development, that's been put into threads. So they're not the be all end all.
Yeah.
Don't think they are, because they're not. They can augment. They fill in some gaps of things that we can do with filler and other things, but they definitely have their place. But they're not, I don't want anybody to get the impression that they can do everything that fillers and Botox can do. We also just added IV therapy. So, if you are back there getting a 1 hour cool sculpting while you're having that done, you can get hooked up and get a little rejuvenating cocktail IV, like a Myers cocktail. We're going to be bringing in different IVs, some for just plain old hydration, maybe from a recovery one from either a recent, like, if you had COVID, God forbid, or you had a real strenuous workout and you just need some help with recovery. So we're going to be bringing in more of those, and you can come in and get an IV even if you're not having another procedure done.
That's awesome.
We have a nice room set up with that, with a little sofa, so it's very comfortable, because it takes about 30 minutes for an IV to go in.
I did forget to ask you earlier. I was just sitting here thinking, when we were talking about bruising, what can patients do? Sorry, guys, back to the filler. Y'all know me, I babble. What can they do to
things
prevent?
That you would do if you're having your wisdom teeth out, or you're having any other surgery done. No aspirin. No non-steroidal anti-inflammatories, which are your Advils, Aleve, ibuprofen. Really, the only thing you should be taking leading up to an injection is Tylenol.
Okay.
If you can. Now, don't stop anything that you don't discuss with your primary care physician or your regular doctor or your cardiologist. Obviously, you're on aspirin for that. And you can inject people that are on aspirin. They're not going to bleed to death from filler injections, but they are definitely going to bruise more. A little bit of counseling. Those patients might want to take 3 or 4 days off, because they're going to have some, but it doesn't mean they can't have them, but they might want to pre-plan a little bit more if they can't stop those things. And then there's some over-the-counter supplements. You can get them anywhere without a prescription, and the main one is called Arnica.
Yeah, that's what I was going to ask you about.
And I do tell people, I think it helps some. I mean, even the plastic surgeons tell people to go get some, so I think it can help. And you're not going to prevent all bruises no matter what you do. Yeah. But there's definitely things you can do to make it less.
Yeah. And so the last kind of thing that I wanted to throw out there, guys, I'm 33. I can't ever be too sure how old I am. Sometimes I think I'm 34 because I tell people I'm older than I am, but
tricks the mind. So and then you realize, oh, I'm only 33.
I know,
I'm younger than I thought I was.
But like, if you want the lips, get the lips. Life is too short. Just get the lips.
Agree.
Like, and it's come a long way.
Like I said, if you've got the money for it and it's bothering you, go get the lips. I will stop you before it becomes ridiculous.
She will, trust me.
I honestly, I'm not going to steer them in a direction that's going to make them look freakish, but if you want the lips, get the lips.
And you can always start slow.
Self-confidence. If it makes you feel better about yourself, I'm all for it.
Yeah.
And within reason, and like I said, you can afford it, and you can take the pain, and it's not that bad. But if all things being equal, go get them. And
I truly think that fillers and Botox are definitely preventing facelifts longer and longer.
I always tell my 30-year-olds, if you don't ever let it fall, then you don't have to pick it up. And picking it up is a facelift. So if you just kind of gradually keep putting filler in over the years and just keep lifting minutely, ultimately there's going to be some people that still have to have the neck. It's very difficult to deal with the neck, not non-surgically eventually in the end. But there's things you can do to like radio frequency microneedling that temps your envy. So there's plenty of things. The neck is better tackled in prevention mode than trying to actually fix it. If you have the turkey neck and it's hanging down 3 inches, I mean, it's a little bit too late. But if we can get these 20 and 30-year-olds focusing on the neck as well and starting to do more machine-based treatments to keep that collagen going, then we may, 10 years from 15 years from now, we may see people not getting neck lifts. But I think we've already come a long way in the facial realm for kicking the can down the road, or even not doing facelifts at all.
Yeah, I agree. And I love that quote. You need to put it on a t-shirt and market it.
If it never, I forgot how I put it.
Oh, don't worry. We got it recorded. We'll listen back.
If it never falls, you never have to pick it up.
Yeah, that's hilarious. Quote, Dr. D.
Yes, filler. That's my motto.
So where can everyone find you if they're looking for you here in Huntsville, Alabama?
So we just moved. Our new address is, and we have it on Google. So if you Google us, you should find the new address. It's 115 Queensberry Drive. We are about a block to 2 blocks off the Parkway on Airport Road, going away from the Parkway. And at the end of what I call, once again, it's the Steinmart Shopping Center. There's a Surin, is a Thai restaurant in there. A lot of people eat there. There's a Starbucks on Airport Road.
Oh yeah, straight. So that's where I go every time.
We're on the other side of Airport from the Starbucks, which is next to Loring Jewelers. So we're just right in there. We're very centrally located, very easy to get to off the Parkway. And then our address is, our phone number is 256-882-6555. And you can email us at info@advancedlifeclinic.com. And then our website is advancedlifeclinic.com.
And then her socials, you can always go to Facebook and like her page.
Instagram. So I have a new marketer. Yay, Summer. She's really picked our social media up tremendously. She's young and she's Instagram focused, and she's doing a good job on Facebook too. But please like our Facebook page. We post almost everything there, our specials, our open houses, new products and procedures that we're doing, trainings we're doing. So it's Advanced Life Clinic on Facebook, and same thing on Instagram.
Yeah. And if y'all did not know, you said you're doing another virtual open house.
We're having a big virtual on April Fools, just because of the way it fell. Everybody's like, "You really want to do an open house on April?" Nobody's going to think these are real, but it really is.
Yes,
it just happened to be a good date for us to do it. But April 1st.
So go. I think there's an event on Facebook that they can sign up.
It's going to be virtual. We're hoping this fall. So we have 2 open houses a year, one in the spring and one in the fall. So April and November. We're hoping that the one in November we can actually have a grand opening, because we weren't able to have a grand opening due to COVID restrictions, and an in-house, celebration with food and music. But for now, our spring open house, we're going to continue. We're going to do that virtually, and we have a temporary website set up that you can buy all the specials. You can call in and buy the specials. We're going to be doing live streams all day long. We're going to be giving away door prizes. We'll announce those on Instagram and Facebook. So y'all stay tuned to social media on Thursday, April 1st, and look for more information about our spring open house that we're having.
Yes, guys. And if you have never attended one of their open houses, you do not want to miss these specials. They do not get better than this.
Yes.
So thank you so much, Dr. Degraaff, for letting me interview you so that people can understand a little bit more about filler and Botox and a little other stuff.
Appreciate it very much.
And I'm sure we'll have a part 2, because I'm sure after everyone listens to this, they always have more questions.
I'll be happy to do it.
All right. So see you later, guys. Thank you. Bye.